What is up, everybody? It is Master Signified Bodies with the second lecture on Jacques Lacan's Seminar 1, Freud's Papers on Technique. I'm glad to see that a lot of people are finding great interest in this series, at least from the first one, and I hope to continue to make better ones and continuously progress. Can't do it without y'all. Thank you for the support. This is still in its embryonic stage, so let's get this ball rolling. I want to give a shout out to Theory Pleeb for hyping this up as well. And if you haven't checked out our discussion on Freud and Jung and Lacan, please go check out Theory Pleeb. I'll leave a link below. With that being said, let's carry on from the first video. The main things to recap on when it comes to Freud's papers on technique, that psychoanalysis as a science is very distinct from all the other sciences. If we could even call it a science, this was Freud's pursuit to make it a science. It does have a similar framework of a generality of creating some type of universal notions to create, in a sense, psychoanalytic facts. However, even though we could say that because there are many analysts, and analysts have many patients, and can find recurring themes, there is a science of a particularity, which is important to the work of psychoanalysis, that a particular analyst has particular experiences with their analysand. And this is due to the importance of the fact that it is an intersubjective relationship, that the measurement is not, if we could say measurement, it is not based upon microscopes, data, or any type of mathematical table or charts. It is the observation and the listening to the patient and allowing the patient to freely associate, to say whatever comes to mind. And it is going and working through. It is allowing the patient to work through and going to this working through towards the cure, or the talking cure is what is at hand. And so that is pretty much what we should be mindful of in the Freudian experience. Now, to also recap on crucial notions that will play out again in this Freudian experience is going to be what was stated last time: transference and resistance. Transference is a phenomenon that happens when the patient's ego recognizes the analyst, and the desire and demands of the unconscious are projected out towards the analyst as subject who's supposed to know or have something that will give me that overall recognition. Resistance does manifest itself within the transference. We see that the ego, again, is the privileged symptom and holds the nucleus of repression. Freud and Lacan emphasizes that it is this metaphor or this notion of the ideational mass, a bunch of intersubjective resistances that happen between the analysand and their analyst. And in this resistance, we come to an example of an analyst by the name of Margaret Little, in which she has a patient who has a radio broadcast show. And so the night before he was supposed to give his presentation at his radio show, his mother passed away. And so he carries on with his show. It goes well. And the next day, he has his session with the analyst, and he has a lot of resistance, kind of being very difficult, even showing resistance by maintaining silence. And he says that, I feel like you are jealous of the fact of my success because I did so well at my broadcast. And she says, not at all, and replies like with pretty much a certain discourse which appeals to his emotions and appeals to the ego, and thus what she does is guide the patient towards the demands of the desire of that ego. And the main thing with the working through and the guiding through the process of the talking cure is the fact that the analyst's job is just to carry out the process of the treatment. It is not to carry out the process of the analyst's ego. And this is an example of how countertransference takes place. Countertransference is, as I would say, the demands of the analyst's ego creating a subjective field or intersubjective field in which the analyst's ego is evoked, and thus we create this back and forth recognition of each other. It takes place in the imaginary plane, and Freud would say that the closer that the analyst is towards the correct discourse, which means the closer that the treatment gets towards the subject, the unconscious, the greater the resistance could be. And before Freud actually started to use the talking cure or the free association and in between analyzing dreams, he used to do hypnosis. But for the most part, hypnosis could only do so much because there was still a layer of resistance that kept from symptoms being worked through. And it is through this working through and talking, because to him, words have a healing power. There is a healing effect that speech has in working through and diving in and working through this process of the unconscious, getting towards those signifiers. And it is the fact that he let go of the hypnosis and started to work through this talking cure that we realize at least the status of the ego and how it functions and how it is its own resistances, and it tries to keep its symptoms at bay, its own repression. It keeps its unconscious at bay by constantly resisting. And we see this with the countertransference, because now the ego gets what it wants. It gets satisfaction from being recognized by the analyst's ego, and thus it's like a lure. It is captivating one's own image of themselves, whether the resistance manifests as hate and conflictual dialogue, or even in a sort of affection and tenderness, love, because as we will see in transference, there is a similar form to love and erotic romantic love, in which there is this demand to validate the totality of my image. I wish to know how I look through the position of the other. As I transfer myself into the analyst, I wish to know, how does the analyst see me? What do they think of me? What words do they have to say about me? And when I get that validation, or when I get the evocation of the analyst's ego projected onto me in words of affirmation or negative criticism, that it doesn't matter. It's the fact that resistance has taken place, and thus it impedes and destroys the continuation of analytic treatment and the process of working through. Again, I'm just going to keep beating a dead horse. I'm going to be a broken record and continuously say the same things, because we're going to hear this a lot throughout the lecture. The main things to know is that the transference, at least resistance, will manifest itself through transference. And this is why it's important to realize in speech, or as he says, like, we shouldn't be like cops and try to look for these resistances, but We should be mindful and aware of when they come in speech. We shouldn't be trying to appeal the patient's emotions. It is important to be, in a sense, the blank slate, to be reserved, because the demands of the ego doesn't know what it wants. The ego is constantly failing at what it desires. And so the more we appeal to the ego, the more that we stray away from the path to the cure. And this is the failures that ego psychology and CBT have, because yes, there are some good things that you can learn from dialectical behavioral therapy or cognitive behavioral therapy or any type of psychodynamic training, existential therapy. However, they don't go towards the signifier. They don't go through the network of signifiers and towards the unconscious. They only stay at the surface and maintain this imaginary relationship. By imaginary, I mean like in the ego relationship, the image. They're focused on validating the image. And if there's something wrong with how the way you feel about your image, then we could do things with your behavior, with your thought process, with how your emotions are, what things trigger you. And it is not that these things have deeper affects, that lie into unconscious or reveal themselves and condense themselves in dreams. It's like, no, you just have to, reprogram your behavior, have a Socratic dialogue. These things maintain ego resistance in the long run. And so there will never be this working through and the reconstruction of the subject's past, the subject's history as it is historicized within the present. And so this is why we need to understand the importance of resistance and transference and how it plays out within the analytic session. Again, this is an ego psychology. This is not a psychotherapy or a psychiatry. This is a different type of method. I hope you all appreciated this. Very short lecture, but these couple chapters were relatively short. Then we're going to get into some deeper material and understand more about the ego. Thank you, everybody, and I hope you have a good night and enjoy your symptom.